Dr. Kashif Baig, one of the country's top cornea, anterior segment, and refractive surgeons, is seen here performing the leading-edge SMILE procedure. Dr. Baig is the medical director of the Herzig Eye Institute in Ottawa.
SMILE is basically removing a small disc of tissue from within the cornea, out of the cornea. And that disc, or the ablation that's done, represents a person's prescription error.
While Dr. Baig performs the SMILE procedure on a regular basis, a few years ago he decided it was time to get out of glasses, especially for reading, so he decided to undergo the procedure himself.
So the SMILE procedure, I think, is a pretty cool procedure. It's got a lot of nice finesse to it. I've had it done on my eyes myself.
And the surgeon was none other than his colleague and mentor, Dr. Sheldon Herzig, the founder of the Herzig Eye Institute.
Being a refractive surgeon, I kind of knew the options, but really it came down to three things. Number one was what technology is going to be the best, who's going to do it, and then am I ready for this, right? And in my mind, I knew I was ready because of this near vision issue I was having.
So in April 2019, seen here in cell phone video, captured by the Herzig Eye Institute's co-founder, Cherry Tab, Dr. Baig underwent the SMILE procedure.
Knowing the technology, I was going to go for SMILE because for me, based on what I had done as a surgeon, based on outcomes that I've seen patients have, and based on my own anatomy and physiology of my eyes, I knew this would be the best procedure for me. And then who was going to do it? If you look in North America, who's got perhaps the most experience doing SMILE procedures, it's Shelley Herzig. So that was really a no-brainer as well. So I was very comfortable going into it because all three boxes were checked off.
For Dr. Herzig, who's performed tens of thousands of laser eye surgeries, the procedure went exactly according to plan.
I can imagine what was going through his head. He's an eye surgeon. He needs his eyes. He's got a long career ahead of him. So he was treated with his dominant eye corrected for distance, and his non-dominant eye was left a little nearsighted. So as you can see with this beautiful face here, there are no glasses there. And he's able to see far away and read without glasses and function as an eye surgeon. SMILE procedure is wonderful.
For Dr. Baig, so used to performing the procedure, being a patient gave him an entirely new and almost surprising perspective.
And the surgery itself was very quick, and I didn't really feel much. I just looked at the green light, and that was it.
How do you feel?
Good. That was nothing to it, really.
So what was your, what were you feeling?
The lights were interesting, and then I knew what instruments were going in, and when I can see the lens were coming out, and when he asked for the rig, I knew what was going on. So I kind of knew what was going on. So the light was pretty easy to follow. Hopefully I didn't move too much. And
You were a model patient.
Yeah, and it was no pressure, no pain. It was pretty easy, actually. Yeah.
That's awesome.
Yeah.
And the results have been even more impactful than he would have imagined.
The next day I woke up and it was a different reality, really. And now I'm able to, play sports, drive, work with during the OR, work on patients, see my patients in clinic. So it's been great for me.
For Dr. Baig, who regularly performs SMILE at the Herzig Eye Institute in Ottawa, the procedure has been a complete game changer, both personally and professionally.
Having gone through the procedure, knowing the healing pattern, knowing about the drops, you can relay this information not only from a physician's point of view, but also from a patient point of view.
These days, back in the operating room at the Herzig Eye Institute in Ottawa, the city's only provider of SMILE, Dr. Baig continues to transform lives with his entirely unique point of view.